The evidence actually suggests that hyperbaric oxygen is not effective for concussion recovery. This is a question we get a lot, and we have a lot of people that ask us and say, "Hey, I've been recommended to try hyperbaric, and what should I actually go through with this?" The evidence says there's probably been a lot of times with concussion we say, well, there's not enough research yet to know one way or the other. With hyperbaric, there's actually quite a bit of evidence to suggest that it is no better than a placebo. So what they do in these studies is they'll take people and put them in a hyperbaric tube. So they'll have like forced high pressure, full 100% oxygen at 2.5 times the atmospheric pressure. And the idea is to drive more oxygen into the body and into the tissues to help things recover. They will then take a control group who also has concussion, and they'll put them into a hyperbaric tube, but it'll be surface air. So there'll be no pressurization, and the oxygen level will be the same as it is in general, just air. So surface air as if it was on the surface of the earth. And what they find is after 40 treatments, so the protocol is like between 40 and 60 treatments, and you do it every day for an hour. You sit in this tube, and it's super expensive. And yet they find that there's absolutely zero difference between people that get the forced 2.5 times atmospheric pressure, 100% oxygen. There's absolutely no difference between them and those that are just breathing surface air. So it's one of these things where these clinics are popping up all over the place. There's one in Toronto. I don't even know if it's still around, but it was called the Concussion Clinic. And so obviously people are going to go to the Concussion Clinic. And all it was hyperbaric oxygen. And yet the evidence actually suggests that it is no better than a sham or placebo thing. So people may be feeling better after their hyperbaric, but that is essentially chalked up to placebo. Because when you do a trial and compare it with placebo, the placebo is just as effective as the actual treatment intervention. So that's my thoughts on hyperbaric. There's actual evidence to suggest that it is no better than placebo. And there's a good amount of evidence. Actually, the Ontario Neurotrauma Foundation came out with their guidelines on persistent symptoms recently, and they had high quality evidence to suggest that hyperbaric oxygen was not effective for patients with persistent concussion symptoms.